Welcome to the Enhancing Clinical Practice and Outcomes stream at SNOMED CT Expo 2024. My name is Liar Tatina and I'm the Customer Relations Executive of Asia and Pacific region and Global Education Lead at SNOMED International. I will be moderating this session today. All questions will be answered at the conclusion of the presentation, and online attendees, please use the Q&A button to type your questions to the presenter. On-site attendees, please use the microphone that's provided here in the room. I'm now pleased to introduce Byung-Kwan Seo from Kyung-hee University, who will be presenting establishment of the Korean Standard Medicine Terminology system in conjunction with Korean Standard EMR using SNOMED CT. Dr. Seo, please go ahead.
Good afternoon, ladies and gentlemen, and thank you for the kind introduction. It is great honor to introduce the Korean Standard Medical Terminology System Establishment Project in conjunction with the Korean Standard EMR using SNOMED CT. Professor Park talked about traditional medicine from the view of the terminology, and I do agree with Professor Park. And honestly, I'm so surprised that because she learned about traditional medicine because it is so difficult for you because it is so complicated, and in this honestly during the preparation of this project I learned again about the traditional Korean medicine because in the field of the Korean medicine it is the major part of the problem because we cannot make the difference from the yin and yang like that. So we have to focus. I think we have to focus on the extreme side of the phenomenon. So I will start with a presentation, and now I will focus on how we can collect organized information from real-world practice. Yeah, let's start with our project. In order to promote data-driven platform of traditional Korean medicine, the Ministry of Health and Welfare of the Republic of Korea is supporting the Korean Medicine Clinical Information Big Data Promotion Team to promote real-world data. But we are focusing on the evidence-based real-world data, real-world situation. This is a big data pilot project to improve public health through Korean medicine. With this project, our objective is improve interoperability between other big data platforms. It means we have to make some points to make interoperability during communication within the traditional Korean medical doctors and Western medical doctors and other all kind of healthcare providers. Along with the changes in the ICT environment, changes are also coming to the Korean traditional medicine, I will say TKM, as we enter the fourth industrial revolution era. In 2016, the Korean Medicine Standard Clinical Practice Guidelines Development Project Group was launched. CPG, it means Clinical Practice Guidelines and Critical Pathway are continuously being developed, and an opportunity for evidence-based treatment has been created. There is a growing need to develop a medical information collection system using EMR. In the fourth comprehensive plan for development and promotion of KM, KM Big Data Hub establishment, including clinical information collection and classification system development through the development of Korean Standard Traditional Medicine EMR has been launched. This is our vision and goals. Yeah, something like that. So a detailed plan was made like this. Development of a standard data set and, development of standard data set, EMR database design, standard EMR certification system is on the way. And it means we have to build our own CDM model, but it must be able to use other CDM, and the interoperability is vital for us. Now, KM Clinical Information Big Data Hub establishment with a researcher support system is currently under development. With the policy development, decision making, and support from Ministry of Health and Welfare Korea, we have to thank to our government. Big Data Center for Korean Medicine was established within NICOM 2021. So this is the fourth year of our project. With the advisory committee, we have two special subcommittee, working group for fire and the SNOMED CT. So we have to we are focusing on the interoperability with this fire and SNOMED CT. To spread the EMR into Korean medicine clinics and hospitals, we are working with two consultative councils. This is the overall procedure for developing a standard EMR database. Based on the CPG and CP of 49 diseases, clinical entities for clinical records were extracted and organized based on main categories. The characteristics of evidence-based Korean medicine treatment are organized into an algorithm, and the treatment components are analyzed using a time task matrix manner. So we are expecting and organizing and mapping and make the interoperability with this rule. Disease-based data analysis, comparison, and mapping to fire, conceptual, logical, physical data modeling, and the EMR framework development have been processing in step-by-step strategy, and I will briefly show in this presentation. This is our promotion steps to build the standard EMR DB of Korean medicine. Step 1 is definition of standard EMR items for input of information on medical treatment. And step 2 is analysis and mapping of components of KEM CPG. Step 3 is development of Korean medicine standard EMR DB. Collected items from CPG and CP have been classified into 16 major categories, including measurement and observation, physical examination, laboratory test, history taking, KM function test, imaging, evaluation, diagnosis, and treatment. And Professor Bak said we use IT-based image functional test. Yeah. All the items have been mapped and assigned for EMR application code. You are looking the medical record management system, EMR management screen on the left. Yeah, yes. I'm sorry, but it is in Korean. Even though it is not a good looking screen composition as a prototype. The screen configuration is based on the information that must be prepared and when the medical treatment is performed based on CPG. From a user-friendly functionality perspective, EMRs need to have a function as a clinical decision support system, and fortunately, we can find some rules with decision support with the SNOMED CT guide. So, following the 5 rights rules to make the full potential of CDS to enhance patient care into reality, to reduce errors and introduce efficiencies to right clinical workflow, we are focusing on right information based on CPG and CP because we developed the CPG and CP based on the evidence-based medicine methodology. So all the records can be accessed with all the records can be accessed with a specified number attributed by each medical institution. It means we can easily identify whose medical record. So all the identifiable records will be anonymized by appropriate procedures according to the law of Korea. The record list, the entire record details, and the record details by items will be seen on a single screen. So Doctors can freely make medical records as they usually do in daily practice, and if they want to treat the patient with a more evidence-based way, they can select the templates developed according to the Korean Medicine Standard EMR DB set. You can easily select with a button. So, but it is so low resolution. Yeah. With the collaboration system with the Korean Medicine CPG development team, experts, and review board by Society of Korean Medicine and academic committees, feasibility, interoperability with the current library have been reviewed. Once extraction of clinical information and terminology from CPG and CP basic terminology is established by standard vocabulary, terminology classifications, including ISO, IC11TM, and SNOMED with a review and consensus between stakeholders. Exports from SKOM, the Society of Korean Medicine, I said earlier, makes SOP for information extraction and classification of CPGs. It means we have the consensus of the stakeholders between traditional Korean medicine doctors. CPG professionals will extract and classify terms according to SOP and then propose the basic terms. The basic term is not the exact academic terminology. We just call it, we just define the basic term can be used as a language set that that can be thought to be most commonly used in the daily practice between patients and medical service providers. The basic terms cannot be selected by a single expert group. So, through the review of SKOM and related academic society experts, the consensus must be reached. This is actual forms for analysis and extraction of CPG terminology. Selection for basic terminology and participation requests used in the procedure of selecting basic terms and mapping with the SNOMED CT and make some consensus between the experts. Following the rules for other SNOMED CT mapping project, we tried to map the TKM terminologies into SNOMED CT with the support of Professor Park Hyun-hye and colleagues. The mapping guidelines were developed, and we think it is most important because the education is most important. So education can be given by Professor Park and Korean Health Information Service education program. So the terminology of traditional Korean medicine terms reflects special concepts and sometimes contains various meanings in single words, such as the characteristics of Chinese characters. So we had no choice but to introduce a multi-level strategy. For now, we extracted the clinical practice terminology from the 32 disease CPGs and clinical experts in each disease who received, as I said earlier, the mapping training, organized the meeting and the classification of the terms before conducting the first mapping. And the mapping results were subsequently reviewed by SNOMED CT experts. So the mapping results from both disease experts and SNOMED CT experts were compiled, and a library was developed consisting of a total of 9,175 terms, which include 2,716 terms classified as not mapped. So we think that is the key, the special terminology for the traditional Korean medicine. So as well as terms mapped as equivalent, broad, and narrow. So we have named this library SNOMED CT version 2023. Yeah. At this point, we needed to seek a solution for the non-mapped terminology. Yeah, collecting the results of each CPG expert extracted terms and mapped to SNOMED CT, as I said earlier, and we focused understanding the source of terms and the meaning and the SNOMED CT browse and community content as was searched to analyze the exact intentions. we need we uh, as Professor Park said, as said, we can make some example about the pulse, because pulse means just a heartbeat is we can feel in the superficial arteries, but in traditional Korean medicine it means it means some kind of diagnostic procedure. So we think the intention is most important thing in the mapping of the SNOMED CT. Yeah. Yeah, Korea Health Information Service KIS operates EMR certification projects. Evaluation will be made across the area such as functionality, security, and interoperability. Our Korean medicine clinical information big data promotion team think the importance of the link and the interoperability with the existing systems in developing EMR standards. So not only how well the current EMR or OCS users can comply the EMR standard, but also we want to confirm how much our EMR standards meet the current EMR certification. We have studied the KM EMR certification standard to utilize Korean medicine EMR for big data, and you can see it can be operated without much difference from the current EMR certification standard. Yeah. In addition, research on the second cycle certification standard in Korea, it has been studied the second cycle of the EMR certification standards. So it's currently in progress, and it is expected that it will be able to apply it smoothly. Yeah. You say that it is difficult to standard Korean medicine treatment because uh, uh, some question from the floor means it is so difficult to what is the herbal medicine and how we can uh, how we can make some information on our EMR. So we decided to start with more significant interventions like herbal medicine and acupuncture related techniques, which are the most we think which are the most characteristic Korean medical treatment. The basic strategy uh, is to extract cause related to herbal medicine and interventions from literature such as textbook and medical books as well as EMRs of actual medical institution. After that, yeah, after that, we proceed with ontology-based conceptualization to create a classification, as the Professor Park showed before. Details will, of course, the classification itself utilizes the existing frameworks. Fortunately, there is a Korean standard medical intervention classification system, including herbal medicine. So it was modified it can be modified within the FUPIC, ICHI, or any kind of reference classification mapping project. This can be the basis for information that collects real-world data in clinical settings and a tool for exchanging mutual information. Yeah, this is a conceptual framework for the development of categorization system for TKM information code. Working with Professor Park Hyun-hye, we can make the basic consensus for information exchange in SNOMED CT. For more details, I can say that next day, with the lightning talk, Professor Chun Hye-sun will show you the detailed examples. Many traditional Korean medical terms share similar or identical meanings with conventional technical terms, so suggesting a high potential for interoperability we can expect. So example of such terms including SLT, headaches, or HB grade, like Bell's palsy, and common cold. It is the same terminology between the Eastern and Western medicine. So terminology system can be used simultaneously, we think. So Yeah. The above efforts would be useless if usability in the field cannot be secured. So we conducted usability research to spread the Korean medicine standard EMR DP because when we doing our when we implement our project, many Korean medical doctor oppose the project because they do not want any intervention from the government or any other forced participation against their wills. So, but basically, we assume that our standard EMRDB set will be used in clinical practice in the future. So, utilized in the conjunction with education and through both online and offline communication tools, we have to develop. We select a medical institution that agreed to implement CPG-based clinical treatment and distributed our EMR framework and checked the usability and collected various opinion. Yep. Yeah, from the evaluation of applicability of a standard TKM EMR, we can significantly findings that through monitoring and evaluation, although chatting with free text as before is faster and more flexible, but TKM doctors agreed on the value of using standardized EMR. So, in order to inform the unique concepts of TKM, it is necessary to standard high frequency concepts. Let's summarize the representative achievement that our big data promotion team has made so far. Big data governance has been established, and it includes advisory commitment, consultative group for medical organizations, and the consultative group for EMR system, and preparation of basis for collection of standard electoral EMR and the connection system of health and medical information and basis for spread in medical organizations have been prepared. This is organizational chart for our future. Various types of medical institutions will produce real-world data, and clinical and non-clinical information will be gathered to become a big data hub, and we will provide the standard. It will not only be used for research, but also support government and policies, and we expect that this will contribute to the growth of related information industries based on Korean medicine. All of these processes will be produced in a way that is compatible with the existing healthcare information systems like KISS, and thereby contributing to the promotion of national health. And in process, SNOMED will be a good tool, we think, for the interoperability between Korean medical doctors and other professionals. Thank you for listening to my long presentation. Actually, I have prepared more detailed information with pictures, but due to my delay in delivering it to the office, so I cannot show you today. It is so. I'm sorry. I'm very sorry. Yeah, this is it. Thank you.
Thank you very much, Dr. Seo. We'll now take the questions. As a reminder, everybody in the room, please use the microphone. And those online, you can type in the question and answer section. Any questions from the audience? Don't be shy. Okay. I have a question. What do you think are the biggest challenges for using SNOMED CT in the Korean medicine EMR in Korea? And what could be the next steps or solutions, considerations to overcome it?
Thank you for the ultimate question. Yeah. Somebody says Korean traditional medicine is not fit for the standardization because we doing daily practice in the tailored way, but in this context we can easily easily break through the problem because we don't think the standardization means all the people use that standard. But this project means we start from the 80 to 85 coverage from all the disease or daily practice. So we can expand with evidence. So our strategy is the expanding from the little part of the grade C to the more vast variety of the field. So we I think SNOMED when our team discuss about the SNOMED mapping and how we can make appropriate access in the SNOMED, I think we can for the standardization we can make the access for the thinking. Yeah. So SNOMED can as the Gao Yongsheng proposed yesterday. We can use the consensus based axis firstly, and we can expand with the evidence, and we have to focus on where we will start. Yeah, that's it.
Thank you. That's great. Thank you. Any questions in the room for Dr. Seo? Yep, just one question.
Does it look to expand the other Korean, for example, China or Indonesia?
Thank you. I think it is not so difficult to expand it from Korea to other country because honestly, October, I met my friends in other countries because there some conference have held in Taiwan, and the theme is how can we use ICD-11 in our daily practice, and how we can make it by AI. So I think the common component is the same. So we can easily expand it. But I as honestly my major concern is in the TM module 2. Because I don't know about the Indian medicine, and I heard that Indonesia and Malaysia and Vietnam has their own traditional medicine. So with the project finding the core components from in Korea, we can expand with them. So.
Thank you very much, Dr. Seo. Thank you. Let's give it a round of applause.